Michelle, thank you so much for joining us. We're not even at the curve bending part. If anything, it feels like the curve is on the upslope. Is there any sort of sign that this is going to curb or that they're slowing down in hospitalizations, or are we just looking at a lot of straight lines up right now?
We are looking at exponential growth right now when it comes to coronavirus cases. Of course, when it comes to the number of people who are infected, but also, as you mentioned, hospitalizations. The number of deaths are rising as well, but that's going to come on the back end. And as you say, we are not yet even technically into winter. It's only going to get much worse from here.
Michelle, I look across to the United Kingdom that's entered its second lockdown begrudgingly. Meanwhile, here in the US, New York's starting to clamp down on people who want to go to the gym after 10 p.m. Remain apparently is one of them. But otherwise, people who want to go to bars, restaurants, it's understandable. But are we going to get any lockdowns that actually stem this curve?
Well, we saw that lockdowns actually do work. That is how we got the virus under control in New York, New Jersey, the Massachusetts areas that were so hard hit early in the outbreak. And then the same thing is what happened across the southern states, the Sun Belt, that got hit when it turned hot this summer and everybody went indoors into the air conditioning. So we know that that's what it's going to take. But as you say, there are no indications across the United States that anyone is willing to do that at this point. And the point is, hospitals are better equipped to handle this, but in many parts of the U.S. that are starting to get hammered right now, they don't have the kind of infrastructure that you have in New York or in Boston or in Minnesota with the Mayo Clinic. You have smaller rural areas that don't have the capacity to absorb all of these coronavirus cases. And I think that that's what's going to have to happen. We're going to have to really be walloped before people know that they have to go back indoors.
Yeah, we've definitely seen some hospitals really be stretched to the limit out west in some of those plain states. I am curious, Michelle, about the therapeutic side of this. There was a lot of talk about the treatment that President Trump received. Is that actually a viable, I guess, alternative, a possibility right now, if someone does come down with a severe case of COVID-19, that they could be treated with that and survive?
Well, the therapeutic that we have now, the emergency use authorization, was for Eli Lilly's product, which is similar to Regeneron,
right.
But it's for people who have mild to moderate infections, right? So it's not those really sick people who we're going to be pulling them back from the edge. It's knowing who it is who's at highest risk, who might actually turn the corner and start getting sick, that are going to need this kind of an infusion. And it's going to be tricky. It is an infusion. You have to go to a doctor to get it. Who goes to the doctor for these kind of things? Usually it's cancer patients and other people like that who you want to keep far away from anyone who has coronavirus. So there's going to be challenges. And of course, they only have a limited number of supply, maybe 50,000 doses here. So not a lot of people are going to be able to get this. It's going to be tricky.
So it's obviously going to be some time before there's really a vaccine or any other robust therapy at scale. But there have been reports that over time throughout the last several months that the fatality, the odds of dying have gotten lower as hospitals have gotten better at treating it with the drugs and therapies that they have on hand. Is that a reason to think that perhaps from a deaths level that this wave won't be as bad as the top line numbers point to?
Well, there is certainly that hope. We know back in the very beginning when this hit, in New York particularly, but other places as well, hospitals, public health officials, everyone was saying, don't go to the hospital unless you're on the brink of death because we don't have anything for you. And everyone's, it's a mess at the hospitals. And so we had people who were struggling at home. And finally, when they felt like they had no other options, they went to the hospital. And then, of course, there was very little to be done. We do know better how to handle these patients. We know what kind of ventilation, how much air they need to be getting. We know that they do better when they're placed on their stomachs in the prone position. We have dexamethasone, so that is going to help people. But, yeah, for sure, the number of deaths are going to increase.
Also, the infrastructure in terms of what went wrong, for example, in New York, and what is being learned elsewhere, and how New York is preparing, for example, for its next wave. A lot of it seemed to be the fact that you couldn't transfer between public and private hospitals. There were these emergency use cases and big buildings being set up to help people that ended up serving next to no one because no one was actually transferred in the ambulances. Do you think that sort of infrastructure is ready?
For sure, there was an infrastructure, and what was there was not being used to the best of its ability. As we saw, they brought in the naval ship, to Comfort to help handle some of these patients, and they ended up with no one. But that exact same situation we're seeing across the United States now. You only have to look at El Paso, Texas, where they're setting up field hospitals and they're bringing in mobile morgues to handle all of the people who are sick and dying in El Paso. That state doesn't even have a national mask mandate. So we're seeing that in other parts of the country as well. We definitely know what has to be done. It's just going to be a matter of having the will, the emotional will, the mental health will to actually do it. And with the idea that there is a vaccine, an incredibly promising vaccine really on the horizon, it's going to be a dark period of time. I don't know that people will see the light at the end of the tunnel, but we are getting indications that it's there. People just have to hold on for, 4 or 5 more months.
Real quick question. Is it the case that the surge in cases that we're seeing around the country is actually helping the vaccine makers accelerate their timelines and get enough data?
That's absolutely true. That is a silver lining here. When you look at the Pfizer and BioNTech data, that's exactly what happened. They were originally going to look at that clinical trial result when just 32 people were infected. And because they started rolling this out in the summer, when we were at the valley of cases,
right,
they were not getting a lot of people who were infected. So they decided that they weren't. They got a lot of criticism for just looking at 32 patients. So they shut down the analysis of the trial to reconfigure their paperwork, basically. By the time they opened it back up, they were going to look at about 60, 65 patients. By the time they opened it back up, they had those 94 infections that allowed them to actually determine what kind of effectiveness rate that they had. So it is happening unbelievably fast in comparison to how it was this summer. Good for the vaccine makers, bad for everybody else.